This is our video on botulinum toxin, where we're going to be following the story of Dolly Parton.
Miss Parton here wants to look younger by stopping the skin around her eyes from wrinkling when she smiles. But how can that be achieved? The answer? Botox.
Having fallen on hard times, Mrs. Parton goes to a suspiciously cheap strip mall plastic surgery clinic.
There, the doctor injects a whole 100-unit vial in one spot, 7 times the recommended dose for treating crow's feet.
Dolly here is going to have some issues, but how is Botox supposed to work and why can it be dangerous? Botulinum toxin, aka Botox, is a drug produced by Clostridium botulinum, a bacterium that sometimes grows in improperly processed canned foods. As a side note, this bacteria is also what causes botulism.
The toxin, when injected into muscle tissue, causes flaccid paralysis. This is why it's used for cosmetics. When appropriately used, injections can semi-permanently relax muscles of the face, leading to fewer contraction wrinkles and a younger look.
Botulinum toxin does this by entering the presynaptic membrane of a cholinergic neuron, which, if you remember, is a neuron that controls muscle contractions with acetylcholine. From there, it severs snare proteins that assist in fusing the vesicles carrying that acetylcholine to the neuronal membrane. Unable to transmit its neurotransmitter, the neuron can't fire anymore, and the muscle the neuron was attached to becomes paralyzed.
The effect is permanent within the neuron, but after 3 to 6 months, new axon terminals and connections to the muscle form, leading to a recovery of function.
So that's how botulinum toxin is commonly used. But what symptoms may result from an excessive dose, like in our case with Dolly Parton?
To start, she will experience bruising, temporary numbness, and discoloration to her skin, but that's all to be expected with any size dosage. With such a high dose, though, Dolly will probably also suffer unwanted paralysis in her nearby facial muscles.
Minor paralysis called ptosis will develop in around 2% of Botox patients, where their upper eyelid will start to droop. Mrs. Parton will probably also have a paralyzed eyebrow and a drooping mouth.
The symptoms would only get worse if the doctor accidentally injected the botulinum toxin intravenously.
If they did that, the botulinum toxin could spread around the entire body, temporarily paralyzing muscles all over and resulting in botulism-like symptoms including difficulty speaking and swallowing, a dry mouth, nausea, blurred vision, and trouble breathing.
Thankfully, Miss Parton called an ambulance immediately, and so will have a chance to treat her.
To treat the possible botulism-like symptoms, an antitoxin called heptavalent botulinum antitoxin, or HBAT, can be used.
HBAT works by binding to botulinum toxin in the blood and preventing it from entering the presynaptic neuronal membrane. It can't, however, reverse the effects of botulinum toxin that is already inside nerve cells.
If, however, the harmful effects of the injection were isolated to Mrs. Parton's face, not much could be done. Doctors would probably just advise her not to rub her face to prevent the toxin from spreading any further, and give her epiclonidine eye drops that would help stimulate the muscles in her upper eyelid to prevent them from drooping.
Thankfully, within a few months, nerve endings would regenerate enough to bring back Dolly's wonderful smile.